Hello, I'm Dr. David Levine. Today's date is May 24th, 2025, and I'm at the Lost Pines Resort in Austin, Texas for the American Association of Plastic Surgeons meetings, where I'm conducting interviews for the ICON Project. The purpose of the ICON Project and these interviews is to preserve in an audiovisual format icons of our society who are teachers, innovators, forward thinkers, and great surgeons who advanced our specialty to where it is today. I hope you enjoy this. Hello, I'm Dr. David Levine, and welcome back. I'm here to interview Dr. Keith Brandt. What is your full name, Dr. Brandt, and day of birth?
Keith Eric Brandt, 7/13/58.
Okay, would you tell us a little bit about your parents?
So my parents, Melroy and Bernice, were both from Weimar, Texas, which is kind of halfway between Houston and San Antonio. Nobody in my family is a doctor. In fact, when we would go back to visit in Weimar, my grandfather would take me to the VFW hall and introduce me to his friends as his grandson who's going to doctor school.
Where is Weimar, Texas?
If you go Interstate 10 from San Antonio to Houston, it's about halfway.
Okay.
But Houston's expanding. It's about to swallow it, even though it's, an hour from downtown.
Well, I bring that up because my wife is on the Weimaraner Rescue Board. So obviously the Weimars came from Germany, the Weimaraners, so yeah. I'll have to tell her that. She'll be excited that there's a Weimar, Texas. She may want to go visit. She loves Weimaraners. How many children or grandchildren do you have?
I have two boys, Taylor and Travis. My lovely wife, Tina, for 38 years. Actually 39 next month. And they're both grown. My youngest is in Dallas working for Lockheed, and my oldest is in Lexington.
Okay, and what does he do?
It's mostly retail, yeah.
Okay.
But no grandchildren yet.
Okay.
And we're telling him, just take your time, find the right one.
Don't be in a hurry.
Yeah.
And how did you meet your wife, Tina, right?
Yes, we actually met during a fem pop.
So she's medical background.
She's an excellent scrub nurse, and it was a fem pop, and true story. The surgeon was 82 years old, and the patient was 79. And thank God the senior resident was there and knew his stuff, because it was like a 10-hour case. And of course, she leaves at 3, right? Her shift was over. And it took me 2 more weeks to find her, because Baylor's a big place. And it went from there.
Wow, that's an interesting story. The surgeon was 82.
His name was Kleinsasser. We called him Special K for short.
Dr. Kleinsasser.
Remember?
Oh, yeah. We have a common background at Baylor. I avoided that operation. I went once and he's doing a fem pop. He was like, don't let me get in trouble here. Don't let me get in trouble here. Gosh darn it. He just keep poking at the vessel. Poor Leroy Kleinsasser.
Yep.
He did some of the first heart procedures. None of them were successful, and then they took that away from him. But God bless him. He was an early surgeon. I didn't realize he practiced that late into practice. Yeah. That's interesting. Isn't that funny?
Yeah.
Yeah. So now, what inspired you to go in plastic surgery?
When I was a medical student at UT Houston, they had actually convinced me to become a pediatrician. And I did some research at MD Anderson and with some pediatric people. And then as part of my third-year rotation, they throw you into surgery, and one of my rotations was plastic surgery. And on the first day, they did a toe-to hand transfer. And I was just in awe, that they could do that and make that live. And when I got to my real pediatrics rotation, which is fevers and colds, neither of which you can do anything for, I said, this is not my life. I got to do something with my hands. And so I switched and went to plastics.
And actually that has a name. It's a THO.
Yeah.
Tell me about your mentors, because you kind of touched on that, where you, yeah.
I didn't really have anybody I could link on to through my general surgery years. And then I was at Tennessee And I got a call from a previous faculty there, and he says, WashU is looking for a hand fellow. And it was going to be year 8 by the time I finished my plastics. I had 6 of general, 2 of plastics. And I really hadn't thought about a hand fellowship because you gotta go, WashU is great, they're doing all this crazy stuff. And I said, okay, I'll go interview. So I interviewed on New Year's Day for that coming July 1st. And they called me the next day and offered me the job, and it was the greatest thing I ever did. Because while I was there, Susan McKinnon shows up. And she starts doing stuff nobody had ever seen before, and it was really awesome. And I just loved working with her. And she was, she had a connection with Lee Dellen, and they would do this nerve course in March every year. So, all right, so here I'm on my 9th year of training. We're going to this course because she wanted me to do one of the dissection tables because I knew her techniques. And on the flight back, this is March now, she leans over and she goes, Keith, you know what you ought to do next year? And I said, yeah, I got a job actually in Fort Worth. And, go and start a life. And she goes, no, you ought to stay an extra 6 months and be my nerve fellow. And I looked her straight in the face and I said, Dr. McKinnon, you're not afraid of my wife, but you should be.
Because you were supposed to come to Fort Worth.
That's right. And I said, and if you know her, she can be very convincing. And it was the smartest thing I ever did. And she helped me, after I left and went back to Texas. I did eventually go back to Houston for a job. But she got me involved in the American Society of Peripheral Nerve, and then from there I got into the American Society of Reconstructive Microsurgery, and it just kept going after that.
A number of my interviews, and the one I remember most about the nerve was Julie Churches.
Oh, yeah.
I did her interview. Gosh, that woman, she got into the minutiae of the nerves, didn't she? You just have to have a love for that to do it. I don't have the brain to that's like playing 8-dimensional chess to me, how she could just, her nerve studies and what she did. It was a great interview though. It was fun because she was an icon, is an icon. And by the way, where were you going to go in Fort Worth? What year was it?
This would have been like 90.
Okay.
And it was a private practice, and I actually forget exactly who it was with. But then I had to switch gears.
Interesting. Yeah, it's funny. Again, we talked about it. A lot of we crossed a decade later. Yeah, but
Texas is a big state.
Yeah, it is. That's right. You know what? There's not many degrees of separation from somebody. Yeah. Somebody knows somebody, etc. Look, during your career, and by the way, mention about your position now as society and talk about the board, because I know you want to do that, and I don't want to forget that, even though not necessarily the question has to do with that, but feel free to segue at any point. That you've seen a lot of momentous paradigm shifts in plastic surgery during your career. Can you tell us a little bit about that?
Well, we were talking earlier, and I'm actually certified in 1995, which was the first year of recertification. And the board community figured out that you can't take an exam right after training and expect that's going to keep you up to date with all the changes that occur almost yearly in every specialty, and especially ours. And so recertification modified into maintenance of certification. And then you probably read that, that just sort of blew up about 10 years ago. There were some of the bigger boards that were making it really onerous on their diplomates, and it just got really very ugly. And so we reassessed at the American Board of Plastic Surgery, what are we doing and how can we make it better for our diplomates? So the process was you had to take this 10-year exam. There was a study guide, which was and it was pretty expensive. And you had to take time off from your office. You had to go to one of those testing centers. Everybody hated that. But if you think about it, if you study really, really hard for a big exam, you're going to be really smart that day, right, and then it's going to trail off dramatically right after that. But instead, if you're exposed to the material every year, and actually you get repeated exposure to things that you're weak on, you will continuously build a level of knowledge. Right. So that's why we switched away from this once every 10-year, testing center exam to an annual online. You can do it at home in your scrubs, and it's 30 questions in your subspecialty. So we have the 4 big ones, craniofacial, comprehensive, cosmetic, and hand. You pick the one that's related to your practice, and hopefully the board is giving you. We really strive to be current. What's the current information and potentially new things that if you haven't made it to a couple of meetings in a while, you may not know about these new things. And we strive really hard to expose our diplomates to that.
Well, when this first came out, and I was luckily grandfathered in, I beat the...
Before 95.
Well, because I was so concerned, I said, look, I did great cleft lips. I could do these other things. I knew the Baxter formula for burns, but I didn't know it anymore. I was basically doing cosmetic surgery 10 or 15 years into practice. And then they said, well, they'll concentrate on what you do, which is probably an evolving of this concept. If you ask everybody about everything, they're going to tear their hair out.
Yeah.
Because it's just, and then it's going to become a negative experience and a frightful experience with a lot of anxiety. So I think it's great that they allowed you to, and I assume you picked one or maybe two fields that you were in, and you just had half questions in one, half in the other, just to make sure you kept up.
Right.
Yeah.
And our selection process is every year you get to pick the one you want. So if you still do hand and you do some cosmetics, you can do one year and do the other. But if you're certified in hand, you always have to do the hand exam because that takes the place of your recertification in hand.
Yeah.
The board, and I must give credit to the board directors. It's not just me. I'm the guy in the office, running the show in the office. But I think they make excellent decisions in how can they best help the diplomates keep up, stay in the front, and practice safe medicine. I think that's really important.
Okay. Well, what do you feel has been the most important, and I think you touched on this, important innovation in our specialty, of our specialty?
I have to say that for me personally, it was microsurgery. I had virtually zilch exposure to that in my training. And then I went to Wash U, and that's when I finally got exposed to a ton of replants and revasc, and Roger Corey was there, and we were doing, at that time, it was called microvascular tram flaps. Now they're deep flaps. But then after that, I went to Houston, and Greg Evans, who's my best friend, and he pulled me over to Anderson initially to do research with him, but then got me in privileges, and I started doing procedures at Anderson. And that place rocks. I mean, we were just doing so many cases. And to see to take it from something that was considered a little scary, these flaps could die, we maybe ought to do pedicle, to something you do routinely every week.
Right.
It was just a fun, real experience.
Well, a friend of mine once said, the more you do, the better you get.
Yeah.
Hopefully. You don't you learn from your mistakes, but yeah, and microvascular surgery honestly takes a certain personality, which by the way I didn't have, because we at Akron City we had just started. It was I went up there practically 75, 76. And Kleinert's work, it was coming out on my revascularization, and the hand surgeons, one of the hand surgeons liked doing it. The other one wouldn't touch it. He just didn't have that personality. But it was 6 hours to replant the distal phalanx of a finger. We don't do that anymore. But that was our learning curve, But yeah, it takes a special personality, and now it's so more advanced because they have the stents, and but then it was under the microscope. Don't move your head, and 6 hours of suturing and then crossing your fingers that everything stayed open because we were in a learning process. Yeah. But I agree with you. Microvascular surgery has changed everything in the way we look at it. So. That's where we are. And I think we touched on the next question, or I think I know what you're going to say. What do you feel your greatest professional accomplishment is?
I really do think we've made some significant changes at the board. So, I mean, I really admired Dr. Noon. He brought the board together and made it a real organization. But then starting in 2015, I think we took it to another level. So when I took over, the oral exam was still all paper. The guys would come with their books, and and we'd get them Thursday night, and everybody'd stay up all night Thursday night putting all these sticky notes, because that's what they were going to ask a question about the next day. And it was horrible for the examiners, because they'd have to go through 20, 25 books that night. So we took it all digital.
Interesting. So, yeah, okay, go on. Yeah.
Yeah. So, well, and it, maybe it wasn't the best exam, because, you were racing through 25 books that night before, because you had to give those exams the next day.
Who picked the books? How did you pick the books? I didn't have that. That's why.
So the candidates have to submit a 9-month case list.
That I had to do, yeah.
But then the oral exam committee nowadays picks 5 for you to come and defend.
Okay.
And those case reports are the blue books. And the teams that were doing the examination didn't get them until Thursday night, the night before the exam. And it was all night with sticky notes, ask them about this, ask them about this.
Okay.
So we digitized the whole process. So now in September, they submit the documents, and then it gets sent to the teams in early September. And they have 2 months to go through the books and create a
study and become an world's expert on whatever they were.
And then they actually make a list of their questions. So because it's it's 7 minutes per case. So
so let's say you were doing a scalp replant, okay, and that was a case they picked.
Right.
Then they would tell you that. Would they tell you what books to read, and if they did, would part of it be the history of the scalp replant? Would it be all the histology? Did you just have to learn everything, figuring somebody may get out to some esoteric, they may make it easy? You don't know. It's a question.
Well, so admittedly, the case report exams, we still have the theory and practice where we give them unknowns, and so you're going to get a breast reconstruction, you're going to get a broken face, you're going to get a cancer face, a congenital face. So we go through all the areas of plastic surgery during the theory and practice. But on your cases, so you made those decisions.
That's right. There were a couple
9 months ago.
Yeah.
Right? So, hopefully you studied 9 months ago.
Oh, I did.
And knew what you thought was a good game plan for that particular problem. But then you have to bring us results, 3-month post-op results.
Right.
And quite honestly, we don't care about the less than ideal result. What really scares the people at the board are the candidate that has a less than ideal result but doesn't recognize it. And then you ask them, well, what would you do to make this better? And they don't have a clue.
Yeah.
Those guys scare us.
Well, that's interesting, and mine was so different. This isn't about me, it's about you. But I think I had a little black. Now, the guys from California came with the embossed books. Okay, I had this black plastic Naugahyde deal with my cases. They were interesting cases, and I had 2 tough examiners. So I'll never forget. I had Ralph Millard as one, and Nick Georgiade as the other. And when we were sitting in Hollywood, Florida, when Millard walked in, everybody said, "Oh God, I hope I don't get him." And the other guy, Nick Georgiade, "Oh God, I hope I don't get him." And I got each of them, and it went quite well. And in my mystery case, I had such good training up in Akron, and they showed the X-ray, the mystery case, and they said, "What do you think?" I said, "It looks like a Lefort 3." Okay, because so that got me, but I was lucky. I was prepared, which you got to be. Anyway, as I said, this is about you, not me. What do you feel the greatest mistake of our specialty has been?
So, actually, the board has looked at some recent data on training programs and getting people certified. And we think that if you get into continuous certification in the board, we're going to help you perform safe plastic surgery. We just found out that 12% of people that graduate from U.S. plastic surgery training programs, accredited, 12% never get certified. And there's something missing there. We need to do a better job of training those people and getting them certified initially and continue in the certification process. And you can always train better. I mean, competency-based medical education is huge now. it has, and not for the purpose of graduating people early, but for documenting that you really are a competent surgeon before we let you out on patients. And we need to do a good job of that, and I see that in the next 10 years.
Well, that's interesting because when you said that, of course, part of it is you got to pass part one of your boards.
Yes.
And if you don't pass part one, and you'll be able to tell me this, you get so many shots at it, right?
And it's limited now.
How many can you take before you're out?
8 years. So you get eight times.
Oh, 8 times.
Correct.
Okay, so they can take it once a year for 8 years
Yep.
for part one, which is...
Well, so you have to become completely certified by the end of 8 years. You have to complete part 1 and 2 within 8 years.
Okay, so if you don't pass part one, you never get to part 2.
Correct.
And which means, ultimately, if you're talking about board certification, like in Fort Worth, you can't take call after so many years if you're not. You can be board eligible, but you can't be board eligible for eternity.
Correct.
At some point, you have to be board certified. So you write your own history, and that's when you said that. I thought that's interesting because I've thought about that. What if somebody doesn't pass their boards? I guess they go work at a clinic, or they.
Yeah, we don't have any information on those 12%. Where are they? What are they doing?
That's an interesting number, though. What do those people do?
Yeah.
Either they got out of the profession or they go to somebody else, but that's not our problem today, is it? So We'll move on to the next one. What about your, I'm going to skip that. I used to say, what's your greatest disappointment? I thought I'm going to be positive here. So what's been your greatest joy? There's a flip, from disappointment to joy.
The serving on the board as an examiner and then eventually as a director, and you really get the sense that the decisions being made by the directors at the board are so designed to help the diplomates. It may not seem like, oh my gosh, I got to pay these fees, I got to do these exams every year, but every decision that the directors make is aimed at improving the care of patients and making it safe. And then when I got the chance to become the executive director and like take it to another level, so now I'm the guy in the office, and whatever the directors decide, it's my job to carry it out, and to see that process happen, like changing the exam, I think, and making it a lot better, the oral exam, switching from maintenance of certification to continuous certification. I think those were 2 big positives, and hopefully there'll be more.
Okay, well, who do you admire most, professional or personal? Doesn't have to be a doctor. It could be anybody.
Dr. McKinnon is someone I've admired. I worked for her for 20 plus years because she hired me back to WashU, and I've been there since 1999. And to see the things that she's accomplished and to be a part of that building of that program, because when I got there, I think there were only 4 faculty. Now we're up to like 22.
Wow.
So she built it for 20 years. Justin Sachs came, poor Justin, he came in 2020, right at COVID. But and he's taken it to another level. So to be part of that growing program at WashU has been awesome. And to be with Dr. McKinnon.
Well, do you have any words of wisdom for present and future generations of plastic surgeons?
Nobody likes taking exams, but the certification process really is about making you a better surgeon and keeping your patients safe. And don't fear the process. Grasp it and be a part of it, and you'll be better.
Okay. Any predictions for plastic surgery in the next quarter century? We're coming around the corner here. That's usually the next to last question.
We're always having to develop new things because we develop things and then we give them away, right? So we invented microsurgery, and now ENT's doing it, ortho's doing it, everybody's doing it. We lost urogenital. I think the next big area is going to be tissue engineering. They're going to finally figure out how to guide that and make that work.
Yeah. That's been a common answer. Mine too, by the way.
Yeah.
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 We'll pass that. We'll pass the Rubicon there at some point.
Yes.
And say, oh yeah, and they'll grow organs in a lab. And I'm sure somebody will not like that and make complaints. But
sure.
what are you going to do? Are there any questions in particular you'd like to highlight or go over? This is the end of our interview for all intents and purposes. Unless there's an idea you said, oh, I meant to mention this or that.
I think I touched on the areas I wanted to.
Okay. Well, Dr. Brandt, it's been a pleasure to interview you for the ICON project.
Dave.
Thank you so much. Thank you for watching, and I hope you enjoyed this interview. All of my interviews are available online at meeting.aaps1921.org. Again, that's meeting.aaps1921.org. And thank you.